Hi everyone, my name is Ross Anderson. I'm one of the urologists at Urology Nevada, located in Reno, Nevada. In this video series, I want to talk about ureteral stricture. And what a ureteral stricture is basically scar tissue or narrowing of the ureter. But first, let's talk about what the ureter is. The ureter is basically a small tube that drains the urine that the kidneys make, and you can see my crude drawing here. The kidneys are on the top of the page, and then the ureters are the tube that drains the urine into the bladder. That's about all they have to do. They're maybe a little smaller than your pinky and between 8 and 12 inches long. I hope this crude drawing was helpful just to give you a sense for where we're working and what we're talking about in this video. Thank you. A ureteral stricture is a narrowing caused by scar tissue within the ureter. Ureteral strictures can happen from many different causes. One of the most common is kidney stones, either from the kidney stones themselves or the treatment for kidney stones. This can cause scarring in the ureter. Some people are born with narrowing or scar tissue within the ureter, usually towards the top near where it meets the kidney, called the ureteropelvic junction. Other common causes for ureteral stricture include radiation or endometriosis, and lastly, surgery, either surgery that other people do or surgery that urologists do can cause ureteral stricture. When the ureter has scar tissue or ureteral stricture, the inside of the tube is not as big, and that causes the kidney to not be able to drain as well into the bladder. When the kidney is not draining well, this can cause many problems, and the worst consequence would be that the kidney loses its function completely. This is a slow process and takes months to years to completely decrease the function of a kidney. The symptoms of ureteral stricture are similar to if a kidney stone gets stuck in the ureter. These symptoms include flank pain or side pain, nausea, vomiting, and overall not feeling very well. I personally have not had a kidney stone, but they say it's one of the most painful things ever. Sometimes if the blockage or the ureteral stricture has happened so slowly over time, some patients don't even feel it, even though it's blocking off the kidney and causing swelling or hydronephrosis. To diagnose ureteral strictures is usually done with radiology or special images in the form of ultrasounds, x-rays, or even CT scans. This would show an area of narrowing of the ureter, and then upstream you would see dilation or a larger ureter, and the kidney often has swelling or hydronephrosis. This clues us in that there could be hydronephrosis due to ureteral stricture disease. The diagnosis is often made also with the aid of small cameras called ureteroscopes, and this is done in the operating room to confirm that there is actually a ureteral stricture. The goal of initial management is to drain the kidney. When we suspect a ureteral stricture and we see hydronephrosis on our radiology, we either need to place a ureteral stent, which is a short procedure usually done under general anesthesia by a urologist, or interventional radiology doctors place a percutaneous nephrostomy tube, which is a small tube that goes from your back into the kidney, and this is usually done under a light sedation. Ureteral strictures are some of the most challenging as well as rewarding cases we do in urology, and one of the reasons why I really like reconstructive urology. That being said, as with all of our processes with our patients, we need to match what we can offer with the patient's goals of care. Not all patients with ureteral stricture or narrowing of the ureter need to have a reconstructive procedure. For instance, patients with advanced cancers may choose to have ureteral stents or nephrostomy tubes to drain their kidneys due to end-of-life care and not wanting to undergo a large surgery. This is a completely fair option, but most patients, if given the choice, would like to remove the ureteral stents or nephrostomy tubes and have their kidneys drain without the aid of any external or internal drains. Once we've made the diagnosis of ureteral stricture, then it's time to talk about repairing them in most cases. You've already had a stent or a nephrostomy tube to initially manage the blockage, and now we want to talk specifically about your patient factors, which could include your medical and surgical history, but also the stricture itself. We want to know if it's short, these are generally easier to fix, versus a long stricture, as well as the location will really dictate what repairs we can offer. But the goal ultimately will be to get all of the drains out and have your kidney naturally draining into the bladder. Please come talk to us at Urology Nevada